All right, Hannah. So this is Hannah, our newest assistant, and we just saw a patient who we had delivered a deprogrammer, and she gave me a look like, I need to know what a deprogrammer is, right? So this is important. So we thought we'd explain this, and I want to try to explain it as briefly as I can, kind of building on what you already know about it. Hannah's been an assistant for a while. She did some endo and some general dentistry, but hasn't run across a deprogrammer yet. So when we say deprogrammer, you're gonna think the functional section of like our dental history and health history. So the bite issues, right? So jaw joint. And so we use this for diagnosis. This is an appliance that John Coyce developed. It's a design where we have this platform that's going to separate the back teeth. Okay, so if I give this to you, and it looks kind of like a little acrylic flipper or something that you would have a tooth on, but there's no teeth on it. It's just this tiny little platform, right? Mm-hmm. You already noticed that when I was showing this to you. But if I gave this to you and you put this in your mouth, your bottom teeth would only touch this platform. Okay. So your back teeth wouldn't touch at all. So what that allows your jaw to do is find a comfortable spot. Okay. So when patients come in and they're in some sort of disarray with headaches or jaw pain, or my teeth don't feel right, or I have to squeeze to make my back teeth touch, this is usually the way that we go to just try to figure out what the problem is. I tend to not jump into too many things until I can know what we're dealing with, and that's what this helps us do. Okay. So it's pretty easy to make. We take a scan and we send this to Evident Digital, the lab, and they design it and then we print it. And so this is 3D printed. That's and cool. Yeah, so it's fairly simple, and we have the patient wear it for 2 weeks. And sometimes more, it just depends. We usually check on them at 2 weeks and see how they're doing. And if they've gotten some relief, if they've got a jaw position, and then we can move forward with how, now we have to figure out how do we make the teeth in the right position. Now that we've got the jaw in the right position with the teeth separated, how do we get the teeth to fit together so that we can kind of throw this away, right? Reprogram. Yeah, it's kind of it's a deprogram, then sort of a reprogram with either orthodontics or restorations or whatnot. But the whole point is to throw this away. This isn't a long term.
Oh, okay. So nobody keeps those.
Yeah, this isn't like a night guard where you would wear it and wear it and wear it to find relief. This is more diagnosis and then like instant relief, short term, to really move into the next step. Because if you wear this too much, your back teeth will start moving because your back teeth aren't touching, right? Yeah. So your back teeth are separated, so they'll start to drift together. So yeah, short term diagnosis, jaw joint problems, and then we can figure out our diagnosis or confirm our diagnosis, and then we can figure out which pathway we're going to go from there. So
cool beans.
Now you're up to speed, right?
Yep.
Okay, great.